my name is Bethany Thomas and I'm here to do an at-home demo of packing wound. So I've already reviewed my physician's order and I have a order from the physician to do a packing for Jake today that is due now. So I've gathered my supplies and I'm entering my patient's room. Upon entering my patient's room, I'm doing a quick safety check, call bells in reach. Patient's in the lowest position and he's not in distress. Hi, my name is Bethany Thomas. I'm a student nurse here. Is it okay if I just verify that you're my correct patient? So as he's verbalizing, I'm looking at his wristband and comparing it to my MR. Okay, so Jake, yeah. And your date of birth? Okay, I have that here. And do you have any allergies at all? No? Okay, I have that here. And then I'll go over his PIN number and compare it as well. So I'm here to do a dressing change that is due today now. This is just because we want to make sure that your wound is healing properly and we want to make sure that we're doing this at a scheduled time. Do you have any questions or concerns? No? And is it okay if I go ahead and go on with this care? Yes? Okay, great. I've also asked my patient if he wanted analgesics prior and he said no. So now I'm just going to go ahead and wash my hands and set up my sterile field. Okay, so I would use this as a garbage bag, and in reality, I would put this at the side of the bed of his where his legs are, and also because we are at home, in reality, I would put the bed at waist level as well as my table. So I'll just drop this here, making sure I'm maintaining stability and I'm within my 1-inch border. Okay, so I won't be needing this. I'll just grab that, drop it into my garbage. And I already have my garbage bag, so I'll just drop that as well. And now I will go ahead and set up my supplies. Oh, it's a little stuck. This way as well. Banana peel. I'm also going to be measuring, so I'll just place this here. Just be careful. And then I'll add my normal saline, making sure I do not contaminate. Okay. Alrighty, so I'm just gonna wash my hands again and put on my clean gloves so I could take off my patient's old dressing. So in reality, I do not have any colorations at home, so I would just be pretending for at-home demo. So I have here, I see that it's about 90% saturated with sero-sanguinous and with purulent borders. There's nothing to be concerned, there's no odor. And then I'm looking at the 2 4x4s. Again, I would say they're about 100% saturated with sero-sanguinous, no odor. I'm gonna use my forceps. I'm inspecting this as well, there's no odor. It's about 100% saturated with sero-sanguinous. This is not contaminated, I'll throw that away. I would also keep this in mind so I could document this in my documentation. I'm also looking at the site. I'm seeing that it's healing well, but we'll get a better picture once it's clean. There's no odor, there's just a slight redness and not that much swelling, so it's healing properly. I'll throw this away. Then I'm going to use this time to measure. So banana peeling this. I'm just going to look for tunneling or any undermining, making sure I'm not applying like too much pressure while I'm doing this. See, there's no tunneling, no undermining. You can see how deep this wound is. Okay, and I see it's about 3 centimeters deep. Good, I'll throw that away. And it's about 3 centimeters wide and 14 long. So I would keep that in mind. I'll write it down so I could document this later. So I'll just place it here so I remember. I'm gonna take my gloves off, throw it away, and then I'm gonna wash my hands. Okay, so now I'm ready to clean. I'm gonna put my gloves on. In reality, I would ask the patient if I could just use the side of his bed, but for now, I'll just use the side of my bed, and I would make sure not to actually turn my back away from my sterile field. Just making sure I'm still in the inch border, nothing to contaminate. Good. I'll throw that away as well. Make sure my gloves are in and I do not touch this cuff here. Okay, so in reality, I would use a full 30 cc's, but for at-home demo, I'm just going to use 10. So I would take this out, activate my safety, put this straight into the sharps. Okay, and I am sterile. So I'd fill this up. Making sure I do not spill in my field. Okay, so I'm going to clean from the cleanest area, and I'm going to do a push-pause technique until my fluid runs clear. Okay, so it's run clear, I'm good. I'll now throw this away, and I'm going to now dry. Alrighty, making sure I do not touch my forceps on the skin. I'm just going to dry that. Okay, throw that away. Again, I'm seeing that it's dried already, so I'm good to clean the peri-wound. So I'll clean the farthest for me. One swipe done. Closest to me. One swipe done. I will still inspect the site, seeing that it is still healing properly. Just a little bit of redness, nothing is oozing out, there's no odor. So I'm just gonna now dry my peri-wound. Okay, apply this for me. Closest to me, one swipe done. And again, I'll just take into consideration how it's looking and it's healing properly. Okay, so now, don't need this, I'll just throw that into the garbage. I'm going to pack. So according to my physician's order, we want to make sure that the packing gauze is saturated in normal saline. And I'm just going to wring out any extra fluid, making sure I do not contaminate my sterile field, which is good. Okay. Alrighty, and then I'm going to now take my Q-tip and start packing my wound. So while I'm packing, I want to make sure that I'm not packing it too tight nor too loose. And I want to make sure that the packing is leveled with the wound itself to the peri-wound and is not overflowing. Okay, so I'm just checking. It's not too loose, not too tight. I'm inspecting to make sure that it is properly leveled. Okay, when I see that, I will throw that away. And then push that in, throw that away, and I'll put this straight into the sharps. So again, according to my physician's order, I need 2 4x4s. So I'll go ahead and attach that on. And I'm no longer sterile, so I will use this, throw that away. Making sure I do not touch the inside, I'll put this on. And I will tape. So at this time now, I will go ahead and clean everything up. But before that, I will take my gloves off, throw it away, make sure I do my hand hygiene. I'll clean everything up, make sure everything's in the sharps and put away. I'm gonna put my patient in the lowest position, clean up everything. Again, if you have any questions or concerns, if you're feeling any discomfort or pain, let me know. I'll come back and check on you in a while. I will make sure I keep my measurements and what I saw on the old dressing, the materials that I use on the new dressing, and my measurements and how the wound is healing. I will now do safety check, exit the room, and I will start my documentation.